Describing a Disease Using Medical Terminology by Giovanni Hayes. Medical terminology is its own language used by all medical professionals. We will discuss the two main healthcare-associated infections known as Clostridium difficile and Staphylococcus aureus. Using medical terminology, we will discuss what the diseases are, its causes, symptoms, preventions, diagnosis, and treatments for both diseases. Clostridium difficile, also known as C. diff, is one of the main health-acquired associated infections in any healthcare facility. C. diff is a bacterium that causes symptoms ranging from excessive diarrhea and inflammation of the colon known as colitis. The colon has a critical responsibility to assist with defecation or evacuation of feces. If the colon is inflamed, it's pretty difficult for the colon to perform its normal duties. The main issue with preventing C. diff is because regular alcohol-based hand sanitizers do not kill C. diff spores. C. diff normally affects those who are on antibiotics or are immunocompromised. The symptoms of C. diff range from moderate to severe infections. Moderate C. diff infections are watery diarrhea 3 or more times a day for 2 or more days, mild abdominal cramping, and tenderness. Severe infections include people tend to become dehydrated and may need hospitalization, watery diarrhea to 10 to 15 times a day, abdominal cramping and pain which may be severe, rapid heart rate, fever, blood or pus in the stool, nausea, dehydration, loss of appetite, weight loss, swollen abdomen, kidney failure, and increased white blood cell counts. Diagnosis or treatments. Diagnosis for C. diff would be a stool test. Ironically, the treatment for C. diff is an antibiotic, which will keep the bacterium from growing. This is ironic because C. diff is normally affecting those who are on antibiotics. Methicillin-resistant Staphylococcus aureus, also known as HA-MRSA, is another big healthcare acquired infection. It is a bacteria that causes staph infection but are resistant to the many antibiotics used to cure normal staph infection. We know that the skin's primary function is protection. It forms a two-way barrier capable of keeping pathogens and harmful chemicals from entering the body. It also stops critical body fluid from escaping the body and prevents injury to the internal organs lying underneath the skin. The symptoms of HA-MRSA are swollen, painful red bumps that might resemble pimples or spider bites. The affected area might be warm to the touch, full of pus or other drainage, accompanied by a fever. These can quickly turn into a deep, painful abscess that requires surgical draining. Boils, a pocket of pus that develops in a hair follicle or oil gland. Impetigo, cellulitis, sores or ulcers are areas of oozing discharge may develop. Toxic shock syndrome, septic arthritis. The diagnosis for HA-MRSA is either a nose swab or tissue from the area that's infected. Treatment for the diagnosis could depend on the physician. They could either just drain the abscess instead of administering an antibiotic. If that don't work, then a certain antibiotic would be given to the patient. Medical terminology is vital because the language needs to be spelled and used in the correct format to help patients. If not, someone could misdiagnose a patient or complicate billing for a patient. In the introduction, I advise medical terms are its own language. There are so many terms that could be transcribed and translated differently. However, we have a medical dictionary to uncomplicate things. If we are ever unsure about the spelling or meaning of a word before assuming, we should always use a medical dictionary. Below are all of the resources that was used to obtain this information.